Welcome, everyone. Thank you for joining us. Today's session brings together a panel of experts to unpack the proposed HIPAA security rule changes and what they could mean for healthcare organizations. You'll hear perspectives on compliance, security, and operations to help you understand the potential impact and prepare for what's ahead. We'll cover key changes, practical implications, and next steps, and then have a Q&A discussion. So first, with that, we'll introduce our panel and get started. Today on our panel, we have Michael Von Ende, we have Andrei Zelinsky, and we have Mauricio Harajan, all from RedLegg's Advisory Services Group. Hello, gentlemen. How are you all doing today?
Well, I'm not going to complain.
You're
going to complain now.
Thank you for introductions, Michael.
Thank you.
Thank you. If you guys want to go ahead and lead us off then.
All right, cool. So let me just put up shared screen. Bear with me, and I should be sharing now. Tell me if that looks okay.
Looking good.
All right, good stuff. Okay, again, just to reiterate who we are, again, it's Andrei Zelinsky, Michael Von Ende, Mauricio Harajan, and Michael Smith. So we're going to be talking again about preparing for the HIPAA rule changes. So what I've done, we are going to have a discussion, and I've prepared a few slides just to start us off on the discussion. So I don't want to overwhelm everybody with slides, but I do want some talking points, and that's where we're going to follow here. So let me see here. We will have a Q&A. I prefer having a very conversational and an interactive approach to the session. Again, I don't want to get up on a podium and explain slide by slide and everything like that. So we'll have a discussion. However, since there's quite a few of us, let's try to hold those questions to the end. We're going to have a Q&A, but at any time you can use the chat and drop in your questions into the chat, and we'll cycle back to them as well. And we will unmute microphones at that time for that conversation. Yeah, without further ado, let's get into what we are looking at for pending changes. Okay, so right now there is in place the Notice of Proposed Rulemaking to strengthen cybersecurity for electronic protected health information. That's actually a link, and it takes us to that web page. I'm not going to click on that now, but there is in process right now something called that Notice of Proposed Rulemaking. And this is the first time that HIPAA has been adjusted since 2013, so it's a long time coming. Which also implies that the original rules, were adequate enough for the last 12 years. I don't know if that's a good statement to say, but we're now looking at changes that have been pending. There's a proposed changes in place, and it's making its way through the process right now. The goal is to strengthen protections for electronic protected health, ePHI. And it's also to bring this more in line with the National Cybersecurity Strategy, which came into the fray in 2023. It's a U.S. government plan that talks about defending critical infrastructure, disrupting and dismantling threat actors. It's really all about strengthening cybersecurity within the United States. It's an initiative that was brought forth by the Biden government. So, yeah. Michael, have you heard of all this before? I'm sure you have, right? You know about the proposed rule changes and stuff.
Yeah, no, I'm familiar with HIPAA and familiar somewhat with the rule changes, although I haven't looked at it heavy in detail. So I'm interested to hear some of your takes on it today.
Perfect. Okay. Yeah. Hey, chime in if you have any questions. But right now, as I mentioned, there is a proposed rule change. So just very broadly, what is that rule change all about? It's again, the goal is to reduce risks to patient safety and data integrity. Again, strengthening the cybersecurity approach to protecting ePHI. And the some of the main bullets behind there is if you're familiar with the old, well, let's call it the current HIPAA, because it still is current, guidelines, you will see that there are addressable and required safeguards. So those addressable things are all going to go bye-bye. It's all going to be required from now on. So all implementation specs become required. Written policies and plans now are mandatory. I think there were some that said there were addressable areas in there as well, and very often you could have informal documentation that might pass. There's updates to asset inventory and networking map. We'll dive into that a little bit more. And it gets a little bit heavier into the risk analysis and risk management. So that in a nutshell is what it is. There's also updates to the privacy rule. We're not going to focus on the privacy rule today, but just as an overview, again, it's stronger protections. They look at reproductive health information. There's alignment with CMS's advancing interoperability initiative, improved continuity of care with patient switch payers, and increased penalties, of course, for HIPAA violations. So that while it focuses in the privacy rule, remember that the security rule is there to protect privacy as well. So without having proper security in place, there is a chance of increased penalties there as well. So what we're going to do is, Michael, I'm going to educate you on some of the proposed changes step by step through the various different safeguards within HIPAA. So buckle up, and I'm going to overwhelm you in a minute. All right. First off, as I mentioned, there's stronger penalties. So the security rule is there to protect patient confidentiality through protecting ePHI. Why are we protecting patient confidentiality? It ties back to the privacy rule, as I mentioned. So one of the things is that HIPAA can now, or there will be, could be, because this is all very much could, this is still in the works, could be increased penalties for violations, which means that we need to have our security practice aligned to ensure maximum protection for patient confidentiality and patient data. So with that, there's also a possibility of moving to a stricter enforcement or auditing. So right now, it's good faith. And with good faith practices, you can do a lot of self-reporting. In fact, you can download a security risk assessment right from HHS website, and you can use that as a self-assessment of your security practice. So they're moving away from that.
Why do you feel that they are moving away from that?
Well, I mean, if you take a look at especially healthcare within the United States, take a look at some of the cyber attacks. There's an increasing trend in cyber attacks within the United States. It's terrible, but they know the hackers know that they're going to pay, right? Because of the strict privacy regulations, there's strict fines, and also the medical industry, can have a lot of money. So I think simply because of that, the increased threat in cyber has, prompted a rule change to have that stricter enforcement. And how can you enforce a little bit better is through audit.
So cheaper to pay the ransom than to pay the fine, or that's at least the theory.
Yeah, and yeah, exactly. But it's even cheaper for everybody to strengthen the security practices instead.
Absolutely.
Okay. All right, go ahead. Yeah.
No, I was just curious. You mentioned on here the audit-ready documentation. What is audit-ready documentation? How would our viewers best achieve that for the ones who haven't had to deal with it?
Yeah, so interestingly, when we do our assessments, so RedLegg does a HIPAA assessments for its clients. I think some of the clients are with us today. And what we do is we approach our assessment very much as an audit. So our assessment is there to help the organization improve its HIPAA security approach. And we do that as a a guidance for the client. So we're not doing an audit on anyone's behalf and not reporting back that to any other body. We work with the client for the client, but we do approach it very much like an audit. And so when we do that, we take a three-pronged approach. So the first one is, do you have written policies in place? Okay, so every single safeguard in there, there's a question, do you have a written policy in place to support this particular safeguard? Okay, so that's the first one. So we'll take a look at all the policies that you have and ensure that it's there. If it's not there, that's obviously a recommendation. The second approach is, do you have process and procedures in place to support those policies? So we'll ensure that you have that in place as well. And again, if we don't find it, that's a finding. And then finally, that three-pronged approach is, okay, so you have what you're supposed to say, you have a procedure in place to back up what you say, and then the third one is evidence. So show us some evidence of that process actually working. So that is audit-ready documentation. If you've gone through any audit, they'll do that three-pronged approach. Do you have what you do you say what you need to say within the policies? Do you have procedures in place to back up those policies and show me the evidence of those procedures actually working? So that's an audit-ready approach. And when we work with our clients, we'll create on their own systems an area where we can prepare policies and procedures and evidence and the assessment itself, and having that at the fingertips. And we'll reference those policies within our assessment. And so if for any chance there would be an audit tomorrow, they're ready. Okay, so that's kind of what that means.
Oh,
all right.
Very makes sense.
Yeah. And okay, so getting into it, we're finally getting into it. What are the proposed changes? So if you know HIPAA, you know that there are different safeguards, and there are different groups of safeguards. And the first one is the administrative safeguards, and that takes care of asset inventory. So there's asset inventory section, there's a risk analysis section, security management section, and there's a workforce security section. All four of these things have proposed changes in place. Okay, so asset inventory. Now we're saying that covered entities and business associates must maintain an inventory of all systems that create and receive or transmit ePHI. So that's a big one. And coupling that is a data flow map showing how ePHI moves through the system. So that is part of the proposed changes. And as I mentioned on the first slide, that's a big one. Another one is risk assessments. So very often we work with organizations, and they may have a risk management practice in place, but are they including all the detailed documentation? Sometimes yes, sometimes no. Sometimes it's a little bit not as strict. We're going to see stricter requirements here within risk analysis. Security management process, again, must implement formalized procedures for identifying and responding to security incidents. So not just responding to them, but we need to have those policies documented. We need to have the procedures documented. And again, evidence in place that we're responding to security incidents in a timely manner and in an effective manner. And then go ahead. Yeah.
I was going to say, so clearly things like asset management and risk management are important in the process here.
Oh, they're hugely important. And in fact, let me tap that one over to Andre. Andre, as you know, Michael, is very proficient in risk management and asset inventory.
Yeah, thank you guys, and hello everyone again. So, Michael, if you don't mind sliding over the presentation, the picture that I just shared before this event.
Yep, absolutely. Let me dig that up. Keep talking.
Yeah, so the picture that you will see in a second is it's a screen grab from YouTube, and it reflects the talk that was given in 2016 by NSA Chief of Targeted Operations. So as you probably know, NSA organization, TAO, is in charge of disrupting activities of foreign states and threat actors. One of the things he is focusing in his presentation, and again, this is 2016, but it's still valid, has tons of good information. I highly recommend to watch this from the beginning to the end. And one of the points he makes is that everyone thinks that those advanced operations, targeted operations, they use 0-day. And it's not the case all the time. Yes, they do. But one of the things he's emphasizing is that when they target any operation in a foreign country, first thing they try to do is to learn about the network. And the goal is to understand the environment better than people who manage it. So you see part of that phrase that he was telling during the conversation. But again, the whole phrase means the following: knowing the network better than people who manage the network. And this is important because if you don't have a full picture of your environment, if you don't have up-to-date information of what systems are in that environment, if you don't have information about what operating system they're running, what vulnerabilities are on those systems, there will be someone who penetrates your organization, does scans, moves around the organization, and finds vulnerable systems. So it's not keeping inventory for the sake of keeping inventory. It's keeping inventory for the sake of understanding what systems you have in place, what vulnerabilities are associated with those systems, and what is the best way to protect those systems from being exploited in your environment. So again, you can see the picture here. Highly recommended to look at the presentation from the beginning to the end. As it relates to risk analysis, right? So HIPAA has traditionally stated something that organizations who are subject of HIPAA compliance should do continuous risk assessments. In reality, that wasn't working like this. Those organizations who actually did perform risk assessment tried to do this in the best case scenario once a year. And if you do this just to tick the box, it doesn't give you all the benefits of a robust risk management program for organization. And that should be a goal of a risk management within your organization, is to have a risk management program. So your information security risks should flow into your enterprise risks, business side risk, and so on and so on. So organizations that, if you look at our clients, let's use an example without naming specifically our clients, they have different levels of maturity. The ones who are well on the way to managing risks, they have fully blown enterprise risk management program, and they look at both at inherent and residual risks, right? So you don't look at the risk just in a specific moment of time. You want to categorize them. You want to have an inventory of risk, and this is something that we advocate very strongly with our customers, or for our customers, is to have as a part of the risk management continuously updated risk register. Having your inventory of the risk is the first step to be able to manage those risks and remediate those risks. And with that, back to you guys.
And Andre, with risk management, I mean, HIPAA is not dictating that you have to use this system or you have to use that approach, right? So it still has that flexibility. Correct?
Yeah, yeah, absolutely. So there is no specific prescription. You can use, when you do risk assessments, there is a HIPAA free tool called SRA. You can use that one. You can use GRC systems if you have one deployed. You can use as a low level or unsophisticated tool as Microsoft Excel to keep those risks. But yeah, the goal is whatever way you go, you need to have inventory of your risks. The way you do it can vary, but the final goal is there: understand the risk and be able to treat those risks.
So it sounds like you guys view this as a starting point rather than this is the gold standard instead. Is that correct?
It's the part of the process. So organizations who have to be HIPAA compliant should establish risk management process, and risk analysis is a cornerstone part of that risk management process. You cannot manage risks until you have done risk analysis.
Gotcha.
All right, and so if we're saying that we can use a spreadsheet, for instance, to manage risks that come up through an analysis, whether it's a vulnerability or a HIPAA assessment or something like that. Okay, wonderful. But when it comes to asset inventory, we can do the same thing, right? We can use a spreadsheet, but I think it becomes a little bit more of a daunting task with asset management, again, depending on the size of your organization.
All right, and maybe the key difference here and key approach is that with asset inventory, you need to do continuous active discovery. You cannot discount, for example, activities of users trying to put their own equipment on the network, right? So your asset inventory is as good as it is sorry, let's phrase it differently. So your asset inventory should be up to date. And the only way for the asset inventory to be up to date, it has to be maintained and updated continuously.
Continuously, yeah.
And we do have a question from the audience. They asked, would the risk register count towards detailed documentation requirements?
Depends on what you document in the risk register. So typically our approach is, first of all, when we do risk register, we try to map those risks to a specific framework, right? So typically we would map them to NIST CSF. So that part. Second, you want to understand which systems this risk is associated with, or which business processes or IT processes that risk is associated with. So another question for frequent debates in our customers' organizations is if there is a vulnerability that touches several systems, would you document this as one risk? Or would you document each system that risks apply to? But to summarize it and maybe make like a general statement, which may help, is that you need to document it to the level that will allow you to fully understand and remediate the risk. If we put something like our server, let's say our database server is vulnerable to multiple attacks, does it help you? Not at all. You have to be specific. So one of the things we actually advocate, and organizations that have mature risk management programs, is ability to generate tickets, or if Jira, for example, is used to generate issues that immediately carry over information from the risk description to the actionable items associated with it. So to summarize, if you have enough information in the risk register to be able to understand the risk and to be able to decide how to handle it, I would call this detailed.
Yep.
Thank you.
Yeah, and to be clear, risk analysis, is going to have many different inputs, and so it has to have inputs from the asset inventory, risks associated with your assets, threats and vulnerabilities, documentation and security measures, and they all need to have that reasonable determination of risk. Is it a high, medium, or low? And there, has to be a justification for that. Okay, let's move on from there. Unless there are any other questions, comments, concerns. Cool. All right. So the next group is a physical safeguards, and physical safeguards means facility access controls and device and media controls. So the first change is that organizations must document physical access policies for data centers and workstations. Okay. And for device and media controls, so there's new requirements for tracking and securely disposing of hardware and media containing ePHI. I think that's kind of clear, unless Michael,
So,
yeah.
no, I did have a question. You talked earlier about RedLegg's audit-ready approach.
Yeah.
So, with documentation, that's obviously pretty clear, but for the physical safeguards, how would you handle that?
So that's actually plays in nicely. So I've seen a number of times where clients may be taking visitation lists. So if someone visits your facility, whether that's facility is your data center or the place where people are working, i.e. the workstations, as mentioned on the slide, if there's a visitor, there should be a visitation log. So we would expect that we're monitoring the comings and goings of all our employees, whether that's badging or otherwise, monitoring their comings and goings, and visitation log. So one of the things I've seen many times is that they may have a visitation log, but if I ask, okay, well, let's see visitation log from last year, well, that's gone. So now, when we talked about audit controls, remember the three-pronged approach. I said it was having a policy, having a process to support that policy, and showing me the evidence that you're actually using that process. If you can show me a visitation log for your data center or your other areas where there's workstations, if you can show me visitation logs from last year, then that means you're maintaining it, and that means you're collecting it. So that piece, the evidence is probably the strongest part of that approach right there.
Are there any, besides the visitation logs, what are some of the other resources needed to help improve the facility access to meet the new control requirements?
Yeah, sure. So I mentioned the visitor sign-in. That was just a good example. But so badge access. So badge access is always a good one. And badge access, depending on the system, is going to be taking logs as well. So badge access, sign-in protocols, even a security guard or someone managing physical access to the various different entries, cameras, automatic door locks on facilities, maintaining that physical, let's call it the security perimeter of the organization. So various different ways to do that. Okay.
Sounds
secure. All right, so that's well, yeah, and so it comes back to this point. Remember, everything is about protecting ePHI. Everything is about protecting data, patient data, and information. So if somebody can walk in the back door of your facility and happen to look at a document that's on somebody's desk, that is a violation, right? So we need to ensure that remember, everything is about least privilege and access for only those people who need that access. And so, if someone can walk in the back door and gain access to privileged data, that's no good. So it's not just about access controls on networks and devices, but also to the door. That can lack sometimes. All right, cool. And then technical safeguards. So as mentioned, there's the whole approach with this proposed rule change is to strengthen our security approach to protecting ePHI. And of course, with that comes in a number of technical safeguards. Encryption mandate. Okay, so now it's required, no longer addressable. It is required to have encryption pretty well everywhere, at rest and in transit. Okay, it's required to be using multi-factor authentication for all access points. So you can see how it's tightening up here. The first one was addressable. If there was mitigating controls in place to compensate for that encryption, okay, you get a pass. You don't get a pass anymore. It needs to be encrypted, bottom line. Okay, audit control. Systems must log access and modifications to ePHI with regular review protocols. And integrity controls. There's enhanced mechanisms now to ensure ePHI is not improperly altered or destroyed.
There's a lot here. How can our clients ensure that they're ready for this?
Well, so let me tap Mauricio for that one, because Mauricio, you do this a lot with our clients, ensuring that their technical controls are up to place. So why don't you, if you won't don't mind walk us through that.
Of course. Yeah, I mean, this is very common in terms of some of the clients that we work with when we talk to them about like securing what is a specific, technical engagement that or technical tools that they want to deploy. They always, they say that we want to secure everything. So that obviously becomes very expensive, very time consuming. So the issue here is what exactly or where exactly in your environment do we find the ePHI and how do we try to secure it? So the first step that I always, try to take with them is like, what are your logging mechanisms that you have in place? So with that, as we see in this technical safeguards, the audit controls that there must be log access for all the regular review protocols. In the past, like the current requirement for HIPAA does not make any specific requirements in terms of being comprehensive as to what type of logs do we need to collect. Now they are asking for very comprehensive logs to specify when, where, what type of data was accessed from where. So this, obviously does give us a lot more information into what we need to safeguard, where do we need to deploy those controls. It also requires us to, or the proposed requirements also ask to integrate those logs with a SIEM solution or with a monitoring solution, so that those when there's something malicious detected, we can be proactive about addressing those needs within the environment. So that, for me, it's always like the first step that I take with some of the clients that we work with. Where exactly do you have ePHI or any type of secure data that you want to secure? From there, who is accessing it, who has access to it, have specific access controls into who does really need the access to that environment, to that data. Where is it? Then from there, try to encrypt it, try to be as safe with it as you possibly can. Add, in terms of encryption, add like a SQL encryption from Oracle. You have it on the cloud. Try to deploy some of those tools that you may have available with Azure or AWS. But in general, I always start with logging and provide as much evidence of what is deployed in your environment as possible, and that will help you comply with any audit requirements from either if it's HIPAA or any other regulation out there.
So that kind of ties back to the asset inventory. It's about knowing what you have before you can start protecting what you have, right?
Correct, exactly. And not only that, but also, as you mentioned, providing evidence of it. For all of our clients, whether they're HIPAA clients, CMMC, PCI, we always recommend having at least 2 pieces of evidence for every control, so that they be, prepared and obviously logging as detailed as possible. That's an excellent piece of evidence to show any auditor.
I like the SIM monitoring requirement now.
Well, that's what I was gonna ask you, Mauricio. So notice that in the audit controls, it says with regular review protocols. So if you have all the automation in place and the SIM and alerting and stuff like that, do you still need to do the regular reviews, and how do you go about doing that?
Yeah, I mean, that obviously, if you have a SIEM, that obviously facilitates the whole thing for you, 1,000%. Just because you're getting the reviews proactively, you're getting the, alerts prior to you actually having to go through and it just simplifies the whole thing. It's instead of looking at pages and pages of logs and trying to find something that pops out to you, the SIEM does that for you. Just telling you where you need to, to focus your efforts, and then you just go into reviewing what those alerts are telling you to do.
Right, but so as Andre was mentioning, and about asset management and risk management, HIPAA won't dictate that you need to have a specific tool in place. So if we don't have a SIM, let's say we're smaller organizations, a doctor's office, something like that. I'm not going to have a SIM, for instance, but I could do this with a spreadsheet, right?
Yeah, you obviously need to have some staff that would actively review those logs, as well. If you have like some sort of a cloud-based environment, you can leverage some of the tools that are in that environment without having the need to deploy like a big expensive solution into your office or anything like that. So yeah, I mean, if you're a small office, you do need to proactively or actively every certain period go over your logs to detect any type of suspicious activity. But yeah, I mean, what's recommended is just to have as much information as you can in terms of detail of who is accessing the logs, so you can proactively do any type of remediation on those.
Okay. All right, cool. Because I think everybody kind of gets stuck here on the technical safeguards, and there's more to it, but this is hugely important. And automation, while not mandatory, is obviously helpful, right?
Of course.
Yeah. Okay, cool. And then this one's a short one's organizational requirements, and it's talking about your business associate agreements, your BAAs. So now we're saying BAAs must explicitly include cybersecurity responsibilities and breach notification timelines. Hopefully your BAAs already have that in place. But if they don't, it's a quick check to ensure that they do have it and make the appropriate updates to that.
That seems pretty clear.
Yeah, that's pretty clear. Yeah. Okay. And then, policies and procedures. So if you haven't clued in yet, HIPAA is really a big chunk about policies and procedures. So now entities must maintain written policies for all safeguards. Okay, and it needs to be updated annually. So that's keeping good housekeeping, ensuring that you keep all your policies and procedures current and well maintained and easily accessible for all stakeholders, whoever needs it. And then the incident response plan. So now formalized incident response plans are required, okay, including breach containment and recovery protocols.
Michael, we do have a question from the audience. HIPAA required an IR plan before. What are some of the new specific things that are now required around IR with this, or will be required around this with these proposed changes?
Well, the big thing here is that it's you can see right there, it says including breach containment and recovery protocols. And in fact, you may have noticed, I don't know if you saw that, Michael, on one of the previous slides, there was already a point about security management. It did say something about incident response plans. I think the nuance here is, so you're going to see this a lot in HIPAA, what looks like redundancy. But it's not necessarily redundancy. It's more of attacking things at two different ways. So it's asking the same question twice in a certain way. And whereas the first one was talking about incident response strategies and processes, now we're talking about the policies and procedures, having that documentation in place. So it's about having incident response plans in place. It's about having IR playbooks in place. It's about ensuring that those incident response plans are developed in a way that that has roles and responsibilities in there, and furthermore, as I mentioned, the breach containment recovery, but it's also about practicing those incident response plans. So it's not just enough to have it in place; it's about having it practiced. I use the analogy of fire department. So fire department knows that they have to, when the bell rings, they slide down the pole, they suit up, they get in the trucks, and out they go. When they're not fighting fires, they're actually practicing that with a stopwatch. Okay, so they have the plans in place and they're practicing it.
How would you recommend that organizations practice those plans?
So actually, let me tap Andre for that one. Andre is being inundated as we speak with a bunch of requests for tabletop exercise. because we're getting towards the end of the year and clients say, hey, I think we need to do our annual review of incident response. But Andre, yeah, what are you working with right now?
No, absolutely. One thing that we always discuss with the clients and emphasize it is that tabletop exercise has to be specific to the client. So there is absolutely zero value if you are delivering a tabletop exercise that was created, scenario of the tabletop exercise that was created for financial services organization to organization that is in the healthcare industry, right? So what you need to do is you need to have a specific scenario that takes into consideration, we talked about risks, right? That takes into consideration the risks that, as long as we are talking about HIPAA and healthcare, that healthcare industry faces these days. Like, what are the threat actors? What are they trying to accomplish? What would be the consequences? What reporting do you have to do? One thing that is frequently not noticed or not so our clients may not be so aware of is that when you report a breach to OCR, you have to provide information about what system was breached. So as compared to other regulations where you just need to notify about any material breach, right? Specifically with OCR breach reporting, you have to tell which system was subject to a breach. And then OCR has a wall of shame where it lists organizations that were breached, and it's on their public website, and specifically which system was breached. So when we prepare tabletop exercises specifically for the healthcare industry, we take into consideration all those aspects, starting from technical aspects, going through regulatory aspects, reporting aspects, and topics such as insurance, costs of the incident, which is extremely important. We advise our customers in a process of delivering those tabletop exercises to look at the expense side of the incident, because majority of organizations do not budget for the incidents, and costs associated with incidents can be significant, just because if you have to do forensic services, no one will tell you how much it costs. It's charged on an hourly basis, and depending on your case, it may be extremely important. So to summarize, right, do not do it in a way just to check the box. It won't help you. And the main point at the end is the purpose of the incident response tabletop exercise is to validate existing incident response plan. If you don't have an incident response plan in place, the benefits of doing a tabletop exercise will be greatly diminished.
Yeah.
Thank you.
Back to the analogy of the fire department timing themselves. If they don't know that they have to slide down the pole, suit up, and get into the truck, they're not going to do too well on their exercise, will they? All right, cool. So that takes us through all the different safeguards within HIPAA, but you know, there's always some knock-on effects. And as we've seen in the last, you know, I mentioned that HIPAA hadn't gone through a significant update since 2013. But in that time, a lot of things has changed in the healthcare area. So this has knock-on effects in the telehealth privacy standards, right? Ensuring that those platforms must, you know, they meet full HIPAA security requirements. AI is a new one. So, you know, there's a knock-on effect there that your AI tools, they must adhere to HIPAA protections. One of the things is fully de-identifying data. And then of state law interactions. HIPAA has always been, you know, what they call themselves a floor, not a ceiling, right? So meaning that if there are state privacy laws in place, they may very well supersede HIPAA. And that's still the case, right? So it's not enough just to think that, hey, I checked my box, as we said, with HIPAA. It's also understanding what the knock-on effects are and what the state implications are. So I just wanted to put that out there.
So the more restrictive is kind of the one that's going to be the one they need to follow.
Exactly. Remember that.
Yeah, just to add a little, and just to add a little bit here, right? So typically privacy regulations have a statement in the beginning, state privacy regulations, saying that organizations who are HIPAA compliance and GLBA compliance subject of both compliances or either one of those, they are primarily ruled by those regulations. But yes, absolutely, there is an overlap. And as privacy controls are tightening, this will be limited, will not be limited just to pure privacy controls. It will affect how you store, encrypt, and what you do with the data, including ePHI.
And this, Michael, this kind of ties back to your question of why HIPAA felt there was a need for an update, and the answer is right here, right? So we've seen new technologies that have been in place now. We're talking about a greater understanding and a respect for privacy, and of course, coupled that with rising threats, it just makes sense to update current
Absolutely.
policies. Yeah. Okay, so I'm looking at the clock here, and probably let's just unmute. And I wanted to, have a discussion at this point and try and figure out what people are doing right now. So what has happened to date? January. Okay, that's when the NPRM, the new proposal, came into place, and in March is where the public comment period closed, with a whole bunch of comments in place. So now it says OCR is reviewing comments and drafting the final rule, and we're expecting an acceptance within the next month or next year. So we're in that last bucket right now, and so people have joined this call because they're concerned, but they're probably also doing stuff right now. So I'll open it up and see who's doing what to prepare.
Do you think that timeline's still realistic, given like the current political divide and everything else we've been through?
Excellent question. I mean, we just had a full government shutdown for 40 something days, right? So if you ask me, I would say, well, you know what? I would say the only predictable thing that we have in our society and our administration and politics right now is unpredictability. It is on hold right now. So there was an executive order that put a regulatory freeze on all new rules, and that takes care of this as well. So there is in place a freeze, and that freeze would be lifted once the HHS, Health and Human Services Secretary Robert F. Kennedy, decides to unhold it and have a personal review. So, yeah. but I think that everything in here is common sense. So even if we go through an unfreeze and an unhold and a signing on it, I think what we might see is some tweaks to it. And I think it may not happen, and I don't believe it's going to happen at all before the end of the year. It may not happen sooner than later, but I think those things that we've discussed are, for the most part, they're going to be accepted. I don't see why they wouldn't be accepted. And there has been opposition, right, from healthcare associations, probably because of the cost and the implementation to do so, as there always is. But I'll counter that with saying concerns around privacy, concerns around hacking, new technologies in place. So, if you ask me if I'm a betting man, I'd say this is going to be implemented. It's not going to be implemented in the next month, but it will be implemented soon. And I think we should take that opportunity right now, while we're sitting around waiting, not to get caught off guard, because once it comes in place, you get about 6 months to comply. That's usually the way things work. So let's take this extended opportunity and start preparing. So back to that. If anybody has some help, how are you guys preparing right now? What are you doing?
I do have something that came in on the Q&A. What risks are there in waiting until the final rule is published?
Well, so there's it depends exactly. Okay, let me backtrack a little bit there. I think that risk is going to be specific to your organization, specifically meaning that how far behind are you? So first thing that organizations should be doing right now, if they haven't done it already, is they should be prepared. So forming some sort of a task force or a program in place that addresses how we're going to prepare for that. So that should be in place today. And then the second thing is to do, even if it's a very rough gap assessment of these proposed changes that we discuss, and they're all readily available. You can do a search and find it, and you can find a checklist from various different organizations. We ourselves have a checklist at the end of this presentation. I'll put up on the screen. But by doing that gap assessment, you'll understand where you stand, right? So how much do I need to do to comply? So the risk of doing nothing is going to be greater for someone who's much further behind. As we said with RedLegg, we already approach our assessments in an audit-ready fashion. So anybody who works with us are a little bit ahead of the game. But I think there's always a risk of waiting, but how much of that risk is, or rather, how impactful that risk is, depends very much on your own security organization right now.
Anyone
Hey,
have
Michael, quick question here. This is Eric. Two questions, and they're unrelated. First of all, how should organizations plan for changes that are not yet finalized?
Well, okay. Can
Is
you
that
give
the
me
inevitable?
I believe it's inevitable. I believe this stuff is going to come down. I don't see why it wouldn't. So if we look at a couple of things like enforce MFA, you guys should be enforcing MFA right now. Is there a downside to enforcing MFA? Yeah, there's a little bit of cost and a little bit of implementation effort, but there's more upside than downside from a security perspective, right? So I think to answer that question, and apologies if I completely forgot what the question was. It was
how do people prepare for something that's not yet finalized? Like, oh, we think it's going to happen. We're not quite sure. Is it inevitable enough that they should take some actions?
Yeah.
I can add a little bit here. So if it won't come from the left, it will come from the right.
Exactly.
So I was reviewing for one of the customers. My role there is to review latest regulations. So a newest addition to California CCPA CPRA talks about annual cybersecurity audit, which has to prove evidence and so on and so on. So what those rules and regulations do, they pretty much include into rules the best practices that organizations should pursue by themselves too. So even if this rule may be delayed or there may be some changes in the rule, if it won't come from HIPAA, it will come from another place. So your plan as a person who manages security or deals with security in an organization is to have, again, a roadmap. And that roadmap should include best practices, also the ones that you haven't implemented yet, but you should implement. So does it, like if this rule won't get adopted, is it the end of the world? We don't need MFA, we don't need encryption? No, because you will be held accountable for something that may be not specifically HIPAA related, but that resulted in the personal information breach, in data breach, and so on and so on. So that probably is a short answer to your question, Eric.
Thank you, Andre. One other quick question, because this is something I've ran into myriad times. Doctors, in the medical industry, they go side to side, they see patients, and oftentimes they just want to click on a mouse and they want everything to be unlocked and they want all the records at their fingertips. How can we impress on, I don't want to say this negatively, but those that are entitled to easy access, to impress upon them that MFA is very important for HIPAA and such?
Andre, you want to take that?
Oh, absolutely. So it's not only the doctors, right? It's a human nature. Security makes things more difficult. But again, we had recent cases of United Insurance, right? We are reading about threat actors penetrating healthcare organizations, about data being patient data being breached, and so on and so on. So if a conscious level is not sufficient, right, then becoming a subject of penalties will be changing that attitude, and this is already changing, right? So can you say that everyone starting tomorrow will be security conscious? No. But as we progress, right, things that were not common before are becoming more and more adopted these days. So this is something to keep in mind. It's a process. It's not turning on a switch. And on our side is the word that needs to be emphasized is educate and help, right? So first, educate what those actions can result in. And second is to help. And again, like you may not follow controls, but if you have a breach, you have to report it to OCR. If you didn't report it to OCR, no matter whether it's an old rule or the new rule, you will be subject of regulatory action and penalty that will be based on the number of the records that were breached.
Cool. We're at the end of the call, and I just wanted to say that I think, Julian, you wanted to send out this checklist. So we just put together a very, very quick checklist on some of the areas that would be addressed in the proposed changes. It's a safeguard by safeguard, some of the different areas in there. So Julian, I think you wanted to send these two tables out to the participants, right? So we'll do that.
Thank you. Thanks, everyone. That brings us to the end of the discussion today. A big thank you to all of our panelists. Hopefully this helped give you guys some clarity. And if you have any further questions or want to continue the conversation, please don't hesitate to reach out and we can set up a call with Michael, Andre, or Mauricio. Thank you guys very much, and you all have a great rest of your day.